In 2014, reports emerged about outstripped capacity and data manipulation at VA medical centers throughout the United States. In the 2 years since, Congress has given the Veterans Health Administration resources to hire more clinicians and to provide some veterans with private care. But questions remain about what reform should be made within the VA and what lessons can be learned from the crisis. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Ashish Jha, a professor of health policy at the Harvard T.H. Chan School of Public Health and a general internist at the VA. Dr. Jha, in a perspective article, Bloche writes that an important cause of the VA crisis was the gap between performance standards and available resources. How does that compare with the VA's own assessment of the problem, and does it factor into the plans for reform?
The scandal that we saw recently had many underpinnings. One of them was certainly unrealistic expectations about what the VA could deliver. A major part of it was also a lack of focus by the VA on what was really important. And so what we saw over the last 5 years was inadequate focus on ensuring that care was timely and delivered in a way that was consistent with what veterans wanted. And I think that was a major part of what led to the scandal. I think there is broad recognition within the VA that important reforms are indeed necessary.
In fact, in another perspective article, Shulkin describes the VA's plan, and it's a plan to evolve into a network that takes advantage of the VA's strengths, but also integrates private sector providers. How has Congress responded to that plan?
I don't know if we have seen congressional response yet. I know that it will be scrutinized closely because some people will worry that this is the beginning of a path that ultimately privatizes the VA. My own personal opinion is that I like Shulkin's idea. I think it offers more choices for veterans, and it allows the VA to manage its capacity challenges by working more closely with private sector providers, many of whom actually see quite a few veterans already.
So if the VA does evolve in that way, one, would it solve concerns about the gaps between performance standards and available resources? And two, would the VA be in a position to maintain the quality of care in these affiliated private provider institutions?
That is the real challenge, is whether the VA can continue to function as an integrated delivery system if it begins to outsource more of its care or as Dr. Shulkin might say, work more closely with private providers. I think there are strategies for doing it. We've seen in the rest of the healthcare system that certainly payers can push provider organizations to both measure quality systematically and selectively contract with high-performing providers. The VA can play that role as well if it wants to. The challenge, of course, will be making sure that they measure the things that are important to veterans and then really stick with the policy of only contracting and working with providers who are truly high quality.
And looking at the situation today, as a VA physician, what changes have you seen on the ground in the past 2 years? How's the system been responding to the crisis?
What we've seen over the last 2 years is a lot more scrutiny over performance measurement and data and how we collect data. I have to tell you that I have not perceived a big difference in terms of what my patients are able to access. I know there's been a lot of increased funding, and I suppose some of it has gone to places where the needs were greater. But on the ground, I don't know if veterans have noticed much of a difference. And as a practicing clinician, the system feels like it's under more scrutiny, but not necessarily meaningfully different in terms of how we're delivering healthcare.
Looking beyond the VA, there are incentives for accountable care organizations, for example, to pursue the same high scores on quality measures while they're cutting costs. Do you think that that could lead to similar pressure on administrators and on physicians to cut corners on patient care across the board?
I think anytime you have pressures to cut costs, there's always going to be some pressure to cut corners, to game the system. And there are important things that organizations can do to guard against that. One of them certainly is to measure outcomes and patient experience focused on things that really, again, matter to patients, matter to veterans in this case of the VA. And I think a major part of the failures in the VA was that we took our eye off the ball about what really mattered and stopped measuring things that were important. And the key challenge for ACOs is to ensure that they have a robust measurement program and one that is difficult to game and where providing right care is easier than trying to figure out how to game the system. That's not an easy challenge, but I think it is one that is addressable.
Thank you, Dr. Jha.